Hello everyone, welcome to another episode of our Wellness Extreme series. Today we sat down with Dr. Maria Colón from Bravo Health and we discussed the topic of immunizations. In particular, we discussed the flu shot, the COVID19 vaccine, and the HPV vaccine. So we hope you find this useful and informative, and we hope you enjoy it. Thank you so much for joining us.
Thank you for the invitation, Diana.
Thank you so much. And this month, August, is Immunization Awareness Month. So we definitely want to start those conversations on why is it important to get vaccinated.
Yes. So, vaccines were created with the purpose of trying to help, the population, trying to help people, prevent certain diseases. Some of those diseases or conditions, like when you get sick, can be viral. Some of those are also caused by bacteria. A lot of these vaccines also were created because it was discovered many years ago that if we vaccinate people, we can prevent the spread of it, and therefore we can control some of these conditions. Some of the conditions for which there are vaccines actually help protect you against things that can be deadly. So for example, things that can be deadly is like tetanus, things like COVID, flu. We also know in the elderly population, pneumonia is something, right, that can lead towards sepsis or them being admitted to the ICU. So vaccines always protect. Like any medication, yes, there can be side effects, but the side effects are always less than the risk of getting a lot of these conditions and a lot of these diseases. And the other thing is, yes, vaccines are not 100%, effective, right? But when you look at it, when you vaccinate a lot of people, right, and that's why this is population intervention, right? So a lot of people that we get vaccinated, then that's why they're so effective, because then we can control the spread of the disease and the condition.
So you did mention, Doctor, regarding the side effects that vaccines may have, right? For example, one of them is the flu shot. What are some of those side effects that people may experience when they get the flu shot?
Yeah, so specifically with the flu shot, right, it should be mild, like flu-like symptoms, right? So for example, low fever, some body aches, a little bit of sniffles. People should not feel like they got actually the flu. And what I mean by this is you should not see high fevers. You should not see persistent diarrhea, right? And you should not see these symptoms for an entire week. Because sometimes, the other thing that people have to think is you do go to your doctor's office or to the pharmacy to get the flu vaccine. And sometimes it can be that you actually got sick or you were exposed to somebody. So, I always tell patients, if you had a lot of symptoms and they lasted for a long time, it was probably not the vaccine, and it was probably that it just happened to be you got sick. Right?
You got exposed.
Yes, but we do know, right, that specifically for elderlies, your diabetics, your pregnant patients, and anybody that has a lung condition like asthma or COPD, the flu vaccine is actually life-saving and can prevent you from getting a flu pneumonia that can be as dangerous as the COVID pneumonia.
Yes, and for example, it's almost September, so we definitely need to encourage people and our family members to take the flu shot. Okay, doctor, so can we talk a little bit about the HPV vaccine?
Yeah, so the HPV vaccine is to prevent the HPV virus. The HPV virus is transmitted sexually. That being said, we like to vaccinate our patients before they're sexually active because we want them to have the protection before they're sexually active. The HPV vaccine is both recommended for males and female patients. Approximately, between the ages of 11 all the way until 35 years of age. So there's always this very good catch-up period. And the reason that we recommend the HPV vaccine is because we can prevent cervical cancer in female patients and penile cancer in male patients. And that is the reason that we recommend it, because these are two very preventable cancers. And we know that cancer is more common in the Hispanic population, and we know that the incidence of cancer within the Rio Grande Valley is also really high compared to other places in the state of Texas.
Okay, perfect. Doctor, is there any difference within getting the vaccine earlier or later in the year? So maybe 13 versus 30. Is there any difference between them?
Yeah, so there is no difference, in protection in terms of the age. What we do know is that the more, so HPV is 3 doses. So the more doses that you have, the more it increases the protection.
Okay.
But also studies have demonstrated that if you receive at least 2 doses, right, that's almost as protective as having 3 doses. So between having no dose or having 1 versus 2 versus 3, if we can get at least those 2 doses in, right, we're giving those children, those adolescents, or those young adults really good protection.
And it's preventable. We do have a vaccine, so definitely we need to take advantage of that. And now it's also August. We are almost getting ready to take our children back to school. So is there anything that the parents should be aware regarding vaccinations before going back to school?
Yes, so the most important thing is my kid up to date? Right? So how can I find out if my child is up to date? So one, you can check, maybe the information is in the Texas Immunitrack, right? Where if the pediatrician or the primary care physician, the family physician participates in it, there you would see all the vaccines that they have received. You can also check your vaccine card, right? And it will let you know, like, these are the vaccines that I have received. And you can ask the school nurses, can review those vaccine cards and let you know your child needs this vaccination before they can come to school. The vaccines will depend on ages, right? So I don't want to go into all of those, right? But usually, it's better to get them before the beginning of the year so that, again, we can protect all of those kids inside the classrooms.
Yes, definitely. And do you have any resources so that people can check what vaccine should they get based on the age?
Yes. So, the CDC website, again, has that information. It has it both in Spanish and English, right, so that you can verify online. Another good source is your local pharmacy. Okay, so a lot of pharmacies have that information, and you can even get some of the vaccines in your pharmacy.
Yes, definitely. And of course with your PCP, right?
Yes, absolutely. Your primary care doctor, your pediatrician can provide you that information.
Okay, perfect. And I think it's important that we also discuss the COVID-19 vaccine. We are still in the middle of the pandemic, and I know that we still need to continue to vaccinate more people. So would you be able to elaborate a little bit more on the COVID-19 vaccine?
Yes. So there are different types of COVID-19 vaccines, right? Depending on the vaccine that you receive, you might need 1 dose versus 2 doses. We also know that these are, vaccines that are under what we call emergency approval by the FDA. So one of the other important things to know is that you might have side effects that are not the most common ones, and that can happen. And we have seen that, with some of the specific vaccines like Johnson & Johnson, with the embolisms, and then Pfizer causing the problems with the heart. Again, what is recommended is that because benefits outweigh the risk, that we vaccinate people. One of the things that is important is if you receive this, one of the COVID vaccines, you will also receive the information for what is called the VARS, which is where you can put in your information and any side effects. And this is also very important because this will help us, physicians. This will help the CDC. This will help the FDA, right, work together to know what are the side effects that are really concerning when it comes to these vaccines and what are the most common side effects for the different populations.
Would you be able to expand on the most common COVID-19 vaccination side effects that you have seen in your practice?
Yes. So most common, pain at the site of the injection. Some people can get some redness and swelling. A cold compress can help with that. We also know that if you're going to take something for pain, what is recommended is Tylenol, because things like ibuprofen, naproxen can reduce the response of your immune system to the vaccination. You might feel very fatigued, some low-grade fever. You might feel very sleepy, some body aches. Some people develop a little bit of dizziness, palpitations, but again, not the most common side effects. Headache might be something that you might also develop. Side effects between Pfizer and Moderna are approximately the same, or it is what is reported in the literature. Personally, in my practice and with my patients, I have seen a little bit more side effects with Moderna, and it's specifically in younger patients, right? So older population even thought they are at greater risk of having COVID and getting a lot of complications because of COVID. For some reason, they don't have as much side effects, and then vice versa. So younger population tends to have more side effects.
Well, that's really interesting. And of course, there's still a lot of research that needs to be done. Like you mentioned, this was something that had to be approved as an emergency. So hopefully we'll continue to learn more about the side effects, but also how this is going to benefit the population, the doses, and all of that. So I think that's something that we need to keep reading about, and hopefully we can get more information.
We're in the process of learning, but at the same time, we do know that specifically now what we have observed is patients that have received the vaccine, even if they still get COVID, their COVID is being much more mild. So it's what we see sometimes with the flu. You might get the flu vaccine, you might still get the flu, but more mild symptoms. And we also do know that for a lot of people, the 2 doses of the vaccine, being completely vaccinated, it is, protecting them. So there is protection that vaccines give us to all, and not only to you individually, but when I say to all the population in your community, in your school, and at work.
Yes, definitely. And I think that's one of the most important things that we need to highlight, that when you get vaccinated, whether it's the flu or the COVID-19 vaccine, it's not only you that are getting that protection, but the people that are around you, your family members, your loved ones, right? So
Yes.
Thank you so much for being here with us, Dr. Colón. Thank you for joining us today.
Yes.
And thank you so much for watching one more episode of the Wellness Exchange. We do invite you to subscribe to our channel, Hidalgo County Wellness Program, to keep watching more of these health and wellness topics. Thank you, and have a good day.